Retina 25e édition, c'est le gros événement de cette rentrée. Beaucoup de présentations, beaucoup de stands. Voici notre sélection.
Remplax, l'application du remplacement médical.
Gene therapy for retina. Retina is a good candidate. Why is that?
When we are looking at common retinal diseases, we have to have safe way to deliver the gene therapy. And the eye itself is a good target because we need very low doses of gene therapy. It's a confined space and it's also immune privilege in most cases. So that's why we are able to deliver billions of vectors with gene therapy in a safe fashion in the eye.
There's actually three phase 3 studies about gene therapy. Can you sum it up?
Yeah, we have three programs in phase 3 development currently. First one is Surovac, which is a subretinal gene therapy for neovascular AMD. We have a vector that takes a gene very similar to ranibizumab. It's an antibody fragment to control disease. A one-time in the operating room procedure. The phase 3 atmosphere and ascent studies are currently ongoing. The next one is Exovac, which is an intravitreal gene therapy. It takes a gene for aflibercept. You inject it in the office, one-time treatment, and is currently in the phase 3 development. The Artemis phase 3 trial is ongoing. And the last one is 4D-150, which is a dual transgene gene therapy, also intravitreal. Takes the gene for aflibercept as well as interference mRNA for VEGF-C. That program is in also phase 3 development. The Forefront 1 and Forefront 2 are two registrational studies that are currently ongoing.
You said earlier that not use the gene factor to repair a gene, but to add a gene.
Right, so this is gene therapy for common retinal diseases. So we are actually taking a gene that the cells don't have and we are delivering it, and then the cells integrate the gene and produce the protein. So we are actually using gene therapy as a drug delivery platform to treat common retinal diseases, in this case neovascular AMD. Now, this is not a gene replacement, so it's not a cure in everybody. If you need anti-VEGF levels that are lower than what gene therapy is producing, then you're going to be injection free. And on average, we have seen 50 to 60% in the phase 1 and phase 2 trials not requiring any more treatment after a single treatment with gene therapy. Now, if you're a patient that needs injections every month, gene therapy likely will not make you injection free, but can significantly reduce the treatment burden. And now getting injection every month or every 6 weeks, you may need injections every 3 to 6 months. So we are using gene therapy as a drug delivery platform to really secrete stable levels of anti-VEGF. I'm personally very excited because this will lead to hopefully better real-world outcomes because under treatment will not happen. The CST fluctuations we see with pulsatile injection may not happen. So this is a very exciting time for our patients and as physicians that we have a treatment option that can potentially change the course of neovascular AMD in the future.
Gene therapy is like AI lately, it's like a buzzword. Do you think it's going to be a standard of care in the near future?
Oh, definitely. It's not sci-fi. It's a reality. We are in phase 3 development. We are expecting data in the next year or two. And if the data are positive, we have three programs. Even if one makes it, we are going to have gene therapy approved here in the next 3 to 4 years. So when I started 15 years ago, it was sci-fi and it was a buzzword. But this is actually a reality. Whether you like it or not, it will likely happen. So it's important for us as physicians to, of course, know the data, but deliver gene therapy in a safe fashion. And I think over the last 10 years or so, we have learned a lot in terms of what to do so we don't get inflammatory events or irreversible vision loss. And the key there is low doses of gene therapy in a safe fashion with prophylaxis for intravitreal gene therapy.
One last question, because I can't know, where do you get these shoes?
They are from Paris. It's Christian Louboutins.
Stéphane, on est sur le stand Intalight. Qu'est-ce que c'est Intalight?
Alors Intalight est une société qui a été fondée en 2014 à la Silicon Valley, société spécialisée en fait sur la technologie OCT, OCTA Swap Source. Nous avons d'ailleurs lancé en 2023 le premier OCT au monde avec un champ de 150 degrés en une seule capture. Et nous sommes fiers en fait d'avoir présenté en avant-première à la SFO le marquage CE que nous avons eu au mois de mai de la technologie Dream, mais également en fait à Euretina cette année le résultat en fait de ce marquage.
Alors Dream, ça nous laisse rêveurs. Qu'est-ce que c'est Dream?
Alors Dream est un acronyme en fait qui correspond à la profondeur de scan, le D de depth en fait. On va avoir aussi également la rapidité. La technologie Dream est disponible en 200 000 et en 400 000 à scan par seconde. On va avoir ensuite l'extension du champ d'observation, puisqu'on passe de 130 à 150 degrés en fonction des appareils. Et enfin, nous allons avoir la précision et l'aspect multimodal, puisque nous sommes en mesure d'avoir des hauteurs de scan de 12 mm sur la partie rétinienne, mais également de 16,2 sur le segment antérieur.
Donc c'est une machine qui peut faire énormément de choses. À qui ça s'adresse?
Alors, dans un premier temps, le Dream s'est adressé en fait aux rétinologues cliniciens. Nous avons plus de 170 publications à notre actif à travers le monde. Donc, c'est un OCT qui a été aussi validé cliniquement. Et aujourd'hui, grâce à l'obtention du marquage CE, nous espérons élargir en fait le champ des applications et aussi élargir le potentiel de l'équipement au niveau clinique.
Donc, qui dit marquage CE dit je peux l'acheter prochainement. C'est une boîte de la Silicon Valley. Est-ce que Intalight est présent en France ou c'est un distributeur?
Alors, Intalight est présent en France grâce à son distributeur qui est Medical Device. Et bien entendu, nous avons aussi un réseau de distribution et de soutien service technique en fait à travers l'Europe.
C'est quoi les prochaines étapes pour Dream ou pour Intalight?
Alors, je vous donne rendez-vous soit à l'ESCRS, mais plutôt l'année prochaine avec probablement une nouvelle présentation de notre technologie Swap Source.
You just finished a presentation about SCS. What is it?
SCS is the suprachoroidal space. Suprachoroidal space is a potential space between the sclera, the white bit on the outside of the eye, and the choroid, which is a very heavily perfused tissue inside the eye.
Why is it a new territory for drug purposes?
It is a relatively new approach, but has been used for a while to, for example, deliver steroids as a long-acting reservoir for drugs. It's now also being used for other treatments, such as gene therapy. And the benefit is that you could potentially use it in an office procedure without the need of surgery.
Basically, how do you do it? What are the devices and what are the risks?
Every surgery has complication risks, but the complication risk here is actually quite low. Of course, you always have the complication risk of a bleed, of infection, etc. But I think the benefit, again, is that you can use it as an outpatient procedure, as an office-based procedure, and the risks are probably comparable to those with an intravitreal injection.
You said this was a great way to deliver a drug because you can get 100% of the retina.
Potentially, yes. Potentially, yes. It certainly allows you to target a good amount of the retina. It depends a little bit on the procedure and the technique and the device used, but more often than not, the periphery of the retina is targeted, and in some indications, that's all you need.
With the uprising of the gene therapy, do you think SCC would be the new territory to deliver drug?
I think it complements our arsenal of techniques that we can use effectively to make a big difference to our patients. For example, if you have patients with diabetes or neovascular AMD, very prevalent diseases, you can potentially offer an office-based procedure to treat them for the long term, and that is a huge benefit to our patients.
This is a really tiny space. What kind of device do you use to get there?
Well, you need small needles and good surgical skills.
Remplax, l'application du remplacement médical.